morning, Dr. Kilt.
Good morning, Lisa. How you doing?
I'm great. How are you?
Awesome. Another beautiful day.
Absolutely.
How's everyone doing? Awesome.
We've had some great feedback. We've had so many wonderful positive pregnancy tests coming out of our support group sessions and our Facebook support groups. And it's funny, now we're in a rebuilding stage because things are getting quiet because all of our women are often pregnant, which we love to see. So we've had a really great past couple of weeks of just a surge of positive tests.
Yes, that energy goes like this. It's a sine wave, and so, but you got to keep on the journey, because even when you're feeling way down here, through support and talking, whether it's personal or whether it's through the chat rooms, it really is helpful. And there's a lot of evidence that that alone builds the oxytocin and serotonin and brings down cortisol and epinephrine, and voila, blood flow to the right organs happens, and then bingo.
Absolutely.
Keep at it. We were going to talk a little bit about endometriosis and inflammation and laparoscopy.
Absolutely.
And it's a hard one to know,
Yeah.
but I personally believe that a diagnostic laparoscopy and hysteroscopy that's looking in through the umbilicus, the belly button, with a little tiny scope, 5 millimeters, can help identifying lesions in the pelvis called endometriosis. And here's a picture of a laparoscopy. Here's an ovary that has endometriosis in it. And the rest of the pelvis looked pretty good. There was a little bit of endometriosis. And that's a sign of inflammation. Inflammation releases the cytokines and the chemicals that inhibit normal sperm, egg, and embryo function and may actually destroy them. And so if you have an unknown cause, it's worthwhile to look inside. If you've done some of the basic treatments like IUI or letrozole, Clomid, I highly recommend it. Sometimes with a vaginal pelvic ultrasound, you can see ovarian lesions of endometriosis called endometriomas. You got it. I think it's worthwhile looking and see. Now, it's controversial. If you're getting pregnant with IUI or you're moving on to IVF, it may not be as beneficial. But if those things aren't working or you're not ready to move on to them, the diagnostic laparoscopy is very, very helpful. And we do it in our Syracuse office, but we also do it in the Albany hospitals and in the Syracuse hospitals local. It's an outpatient procedure. It takes about an hour. You're put to sleep, sedated. We also combine that with a hysteroscopy. That's looking in the uterine cavity and looking for polyps, small fibroids, adhesions, small septums, which often can be diagnosed ahead of time, but if not, I think it's worthwhile looking inside. There's also some evidence by just doing the procedure and doing a little scraping of the uterine cavity. That also helps the stickiness and increases pregnancy rates and implantation. So although it's a invasive procedure, and most of us aren't quite ready to get the knife, but it's a very tiny knife and a very tiny incision. And I've seen so many people where they did the laparoscopy and found sometimes very minimal endometriosis, and then they get pregnant. And the cases where someone's actually had a little bit of endo, you cured it, they got pregnant, had a baby, they weren't able to conceive after that, came back and said, another laparoscopy, sure, and guess what? It happens. And so sometimes it's hard because the scientific literature doesn't always tell us the right answer in an easy way. And sometimes you have to go by the heart. And if it's worked before, sometimes it's worth a do, I say.
Absolutely. Well, thank you for sharing this information. We also have a great webinar coming up with Heather Guidone, the program director for the Center for Endometriosis Care. That'll be next Wednesday at 6 o'clock. So she's going to be sharing some of her emotional support, coping mechanisms, and some of the diet and lifestyle support that can also support endometriosis. So be on the lookout for that. And we have our great Q&A webinar coming up at the end of the month on the 28th, where we get Dr. Kiltz for an hour to ask and answer questions live. So that'll be a wonderful event as well.
Well, we look forward to it, and please don't hesitate to ask the questions, because we're always here to help. And through the conversation, we feel empowered, and through knowledge, we feel better able to move forward in the journey and the process. So have a great day.
Thank you.
My pleasure, Lisa.